I'm basically going to focus more on the lifestyle changes that we have recommend all patients with congestive heart failure to follow. Okay, so number one, for whatever heart disease you may have, is to quit smoking. Smoking is one of the biggest risk factors for coronary artery disease, for heart attacks. And we know that heart attack is the leading cause of congestive heart failure in the United States. So first thing is to quit smoking. Monitor diet. So I have to follow a low salt diet, and I'm going to go through the details later. Exercise regularly, lose weight, also check weight dailies, avoid alcohol. Alcohol has a negative impact in the cardiac function. So the more alcohol you drink, that can make the congestive heart failure worse. And also limit caffeine. Caffeine can increase the blood pressure. Patients, the weak heart doesn't like to work with elevated blood pressure, and also caffeine can cause some arrhythmias. Almost every food that we eat, there is sodium. It's very important for our body function. But we don't need to eat a lot, okay? And the problem is the more salt or sodium that you eat, that will lead to accumulation of fluid. This extra fluid will put an extra work on the heart and your kidneys will have to, it will be harder for your body to get rid of this extra fluid. This will usually result in a higher blood pressure. And this higher blood pressure and this extra fluid in the body will eventually lead to the heart failure symptoms, which I mentioned: fatigue, shortness of breath, trouble breathing at night, swelling. What is the recommendation? So the American Heart Association recommends low sodium diet for most patients with heart disease, including hypertension. And that means diet with less than 2,000 milligrams of sodium a day. And that's very hard to explain to a patient what is 2,000 milligrams of sodium. It's important to understand that also some patients that have hypertension and congestive heart failure, which we see the combination of the two together, they actually we have to recommend even further lower intake, about 1,500 milligrams of sodium. Alternative seasonings you can use that don't contain sodium, so basically a bunch of herbs, garlic, and I have the list there. There's some people that use there's a low sodium salt that some people like to use, and they ask me. The problem is that if they use that, they usually tend to put more because it doesn't give the same taste. So in the end, you end up with the same amount of sodium in the end. So I usually don't recommend using too much of that also. About 1 tablespoon of salt has 2,300 milligrams of sodium, which is already more than the daily recommendation. So it's a very small amount of salt that you put, if you add in the food, that you're already above what we recommend. The more processed the food is, more sodium it contains. So everything that basically comes inside a can or a package and it was frozen has salt, because it's one of the ways to keep it, to preserve it for a long period of times. It's very important to learn how to read the labels. Basically, you just go to the label, find the sodium, find the amount per serving. There is 300 milligrams for half a cup, and that's the size of serving. So if you have a full cup, which will be 2 servings, that's 600 milligrams. And again, as I said, the goal is to stay below 2,000 milligrams. 600 milligrams, that's already more than a quarter of the daily intake. So it's very important to keep track of that if you're going to use processed food mainly. Fluid. This is very controversial. I basically recommend fluid restrictions for patients that have a lot of swelling and they have a lot of shortness of breath. For those patients, ideally limit to about 64 ounces, and depending on the symptoms, how much swelling, I may restrict more. I think the biggest important thing regarding fluids is to check the weight. Some patients, they have congestive heart failure and they don't have much swelling and they don't have weight gain issues. Some other patients, they do have, and then if they monitor the weight and that there's not a big jump in the weight in a few days or daily, then most likely they're doing the right thing regarding the fluid, how much fluid they're consuming every day. But if there is let's say 2-pound gain daily, most likely these patients should be on a more restrict fluid diet. Exercise is very important. And that's one of the things that happens with patients with congestive heart failure. The sicker they get, the more shorter breath they get. They give up on exercising, give up on doing the regular things that they used to do. So it's important to move, to be active. And the reason is to keep, in particular, the muscle in the legs active. We have those are the biggest muscles we have in the body. And if you don't use that, you lose that. And the less muscle you have in your legs, the more tired, the more shorter breath, the more fatigue you're going to feel on exertion. And that's going to have a huge impact in the quality of life. So we want the patients to pick something simple and enjoy and start slowly, increase gradually. So start for 5 to 10 minutes and progressively increase. Walking is the easiest thing. The goal is 30 minutes a day or most days of the week. I'd say at least 4 times a week. We recommend avoiding heavy weightlifting. That's bad on the heart. But we do have to gain some muscle. It's important, as I mentioned. So you can focus on light weights, repetition, use elastic bands. Those things help. And again, don't overexert yourself. Know your limits. And when you get out of breath, if you have chest pain, just stop, wait. And when you decide to try again to exercise, just take it easier. So medications, I'm not going to go through a lot because Dr. Elena has a talk. And the biggest message is take daily. Take your medications. Don't forget, because that's one of the leading causes for admissions we see every day in the hospital are patients that don't take their meds. And they don't take their meds either because they're taking a lot, either because the regimen, they think it's complicated, sometimes for financial issues, but then if there is a financial issue, always talk to the physician and then we'll find ways to try to help you. Sleep apnea. It's something that I just want to mention briefly because I see a lot. And it's basically the most common type. It's called obstructive type. We see more in obese patients, overweight patients. They have trouble breathing through the night because basically the airways in the neck, they collapse and you don't have good airflow to the lungs. And sometimes the wife or the husband, less often, will notice that there's a lot of snoring. The husband is snoring a lot. That sometimes he chokes and he eventually breathes again. And patients complain of a very poor sleep quality. They wake up feeling tired and they feel out of breath. And we know this is associated with congestive heart failure, with heart disease, with arrhythmias. And the treatment, if we detect with something what we call a sleep study, is to use a mask around the nose and the mouth, and that mask basically helps to push air into the lungs. And I have a few experiences of patients that dramatically improve fatigue and shortness of breath after starting the appropriate therapy. Call the healthcare provider. If the shortness of breath is getting worse, the swelling is getting worse, if you're requiring more pillows to sleep, again, as I said, this is one of the symptoms of heart failure is shortness of breath, laying flat. If there's chest pain, if there is patient is dizzy or fainting, or if there is a sudden increase in weight in a few days. Of course, if there's fainting, if there's prolonging chest pain, or if there is shortness of breath at rest, don't wait until your physician returns your call. Just go straight to the emergency.